Good evening, everybody. It's now 7 o'clock. I'd like to start the meeting of the Health and Wellbeing Overview and Scrutiny Committee. Before I start, we're going to have a little change of the running order tonight. We are going to take item 11 immediately after item 7 in the agenda, but I'll remind you of all that when we get to there. As there are a few people that are new on the committee tonight and a few sort of extra people around the place, I'd like to ask that everybody introduce themselves, please. So I shall start. I'm Councillor Graham Snell. I'll be tonight's chair. I'm leader of UKIP.
Good evening. I'm Angela Sheridan, councillor for UKIP.
Good evening. I'm Councillor Gary Collins for the Conservatives.
Good evening. Good evening. Is that working? Good evening, my name is Councillor Jane Pothecary and I am a substitute on this committee, standing in for Councillor Victoria Holloway.
Good evening, I'm Oliver Garish, leader of the Thurrock Labour Group, and I'm also substituting tonight for Councillor Cliff Holloway.
I'm Councillor Holden. I don't sit on the committee, but I'm the Cabinet Member for Health.
Tom Abel, I'm Chief Transformation Officer for Basildon Hospital, Broomfield Hospital and Southend Hospital.
Tim Elwell-Sutton, Consultant in Public Health.
Mark Tebbs, Director of Commissioning, Thurrock CCG.
Irene Lizzie, Head of...
I'm Andrea Clement, Public Health Registrar.
Roger Harris, Corporate Director for Adults Housing and Health.
I'm Kim James, I'm Chief Operating Officer for Health Watch Thurrock, who are the independent organisation that speak to the people of Thurrock about their health and social care services.
Good evening, I'm Ian Evans, I'm the Director of Thurrock Coalition, the user-led organisation for Thurrock.
And I'm Jenny Shea, Democratic Services.
Okay, thank you, everybody. I'd like to remind everybody that everyone present will be recorded for publication on the Council's website, and that will normally be available within 3 working days of the meeting. I would also like to remind members and officers to use their microphone when speaking, please. Okay, item 1, apologies for absence. Do we have any apologies for absence?
Apologies from Councillor Victoria Holloway and Councillor Pothecary will be substituting, and an apology from Councillor Clifford Holloway and Councillor Garish will be substituting, and an apology from Councillor Watkins.
Okay, thank you. Item 2, minutes. I move that the minutes of the Health and Wellbeing Overview and Scrutiny Committee held on the 15th of March be approved as a correct record. Are there any comments as to the accuracy of the minutes? Agreed. Excellent, thank you. Let's just on this one. Right, thank you very much. Item 4, declarations of interest. Do I have any declarations of interest? Nope. Lovely. Item 5, terms of reference, which you can be found on page 15 to 16. Do we have any comments on the terms of reference? Fantastic. That's none. So we go on to item 6, items raised by Health Watch. Kim, do we have any items tonight?
Yes, please, Chair, if I may. As I stated earlier, we are an independent organisation that serves the people of Thurrock around the health and social care services, so we listen to any issues they may have, or feedback on services, good and bad. And we have noticed over the last 3 or 4 months a big increase in complaints coming forward around services delivered from Basildon Hospital. Some of those have been quite serious, to the point that when we've passed them on to the CCGs involved, which is actually Basildon and Brentwood CCG, as they run the contract with the hospital, that they were serious enough to have been recorded as a serious incident and be investigated, but they hadn't been until we raised it, and the investigations are now ongoing. There are day-to-day stuff that's picking up as well, which is around appointments being cancelled and misinformation being given to patients, wrong letters being sent to patients, patients having the wrong notes. So it's quite low-level stuff, as well as some really serious incidents. all of the calls, all of the complaints, all of the issues that we take, we enter onto a system which every health watch across the country uses, which raises up to the CQC. They have been in contact with us because they're concerned about the amount of information that's being raised. So it's only right and proper that we bring this to you now, because if this should escalate into something bigger with the CQC going back in, it's only right that the people that need to know that there is an issue. Obviously, I'm not going to go into too much detail, but one did involve a 9-year-old child who nearly lost his life. He was 4 weeks on intensive care in London, full life support, and he'd been turned away from the hospital on 5 occasions over a 48-hour period prior to that. That is being investigated, and it has been raised as a serious incident in the hospital, and there is a full service review being undertaken. But my concern was that didn't seem to have been happening until we raised it, and had that not have been raised, I don't know where that would have gone or even been picked up. We contact the hospital all the time. We had a very, very good relationship with Tom until, unfortunately, Tom got pulled away to do success regime work, and some of the big players that have been in the hospital over the last couple of years who did turn it around have also been pulled away. Whether that has an impact on what's happening, I'm not sure, but we haven't got the same response as we were getting beforehand. So just thought it only right that it comes to yourselves. What you want me to do with further information, I've got an appointment with James to feed back, and I have already spoken to Roger about my concerns.
Anybody got questions? Oliver.
Thanks, Chair. Clearly that's quite concerning, I think, for this committee to hear, and I think I guess in terms of the steer we take, we don't want to get into discussing individual cases in this meeting this evening, but what would certainly be interesting perhaps after this meeting is if further information could be made available to members of the committee to make sure that we are fully aware of the incidents and understand some of the background.
Thank you, Chair. Yeah, I echo Oliver's concerns. Is there a common theme with these incidents? Is it poor training? Is it poor leadership in a clinical sense? Is there any one thing? Could you tell us, please?
Unfortunately not. It's very sporadic, and it seems to be in lots of different areas. As I said, we've had quite a few reports of people coming away from the hospital with wrong information. It's actually wrong patients' notes, and they've had treatment that wasn't actually for them, it was for another person, but their notes have got confused. We've had 3 or 4 of those. We've had people sort of appointments not being carried out and being cancelled continuously, which has resulted in them being very, very poorly. So it is a bit of a mix across everything. Outpatients, A&E, they seem to be at the moment the areas that there seems to be a bit of a slide going on.
Okay. So it sounds like nobody's actually organising anything or coordinating anything. Is there somebody who's supposed to have that role in the Basildon hospitals to ensure that everything runs properly and deals with it? If it doesn't, deals with it straight away?
As far as I know, each area has to have a service manager, so there should be somebody in each area overseeing that, and they're the people that are now picking up our issues, that we take it to the top and they filter down to, I believe it's a service manager for each area, and they're dealing with it. Why they're not picking it up before it becomes the issue, I can't say, because obviously I don't work there. We just pick up the complaints from the residents.
Thank you, Chair.
Yeah, it's very disconcerting, Kim. We've kind of been here before, I seem to recall, and then we were given assurances that things were improved, and it seems that's not been the case. Do we know there's been any sort of action plan put in place yet, or agreed to resolve these issues?
Not at the moment, but I think if CQC do get involved and they then go into the hospital to do inspections in that area, I think that's when an action plan will come from it. Or at a higher level, somebody nearer the top would look at it and start sort of picking up all those individual cases.
Yeah, Tom.
So, yes, obviously, Kim raised these concerns with me prior to the meeting. Obviously, they are very concerning. I've spoken to the site leadership team at the hospital around what's going on for these individual cases. They are being picked up by the clinical teams involved, and there's a pretty rigorous process we go through when we trigger an incident to investigate why that happened, what was missed in terms of the clinical care of that patient, and what can we learn from that in terms of changing the way that the services operate. Obviously, the more concerning thing is that we aren't potentially identifying those incidents when they occur. So it's not that once an incident happens, we don't follow a good process. It's more around, are some staff missing incidents, and or are patients not feeling able to report their concerns about their care. So those are the two key things that we've got to quite rapidly get our heads around. So I spoke to Dawn Patience, who's our Director of Nursing, on Friday, following being alerted to these incidents, and she's pulling together some information around what we are doing to make sure that staff are very clearly aware of what an incident is and what it isn't and how they should report it. Basildon's historically done really well in terms of increasing the number of incidents that it reports, which is a good thing, because actually the more incidents report, the more opportunity there is to learn. And we need to do some analysis to see if that's changed in terms of we're reporting less incidents and therefore we're potentially missing things. And then secondly, the work that we're doing in terms of giving patients the information they need, so when they are concerned about the quality of care at the hospital, they know who to talk to, so we can kind of fix it as quickly as possible for them, and we can trigger the processes. So I'd be more than happy for us to come back at a later date to this committee to report on that investigation, where we've got to and what we've learned.
Yeah, in fact, I think that's actually quite crucial that you do. I mean, as I said earlier, it's not that we haven't been here before. This has happened previously. And, we are constantly being told that things are improving, systems are being put in place. X about happening again, a bit like the wonky microphones. We'll arrange that with you. I'd like to see, the analysis of why it's happened and what your future. Gary, you got something to say?
I do have a question about sort of how you go about sorting this out. I mean, do you keep a score? Doctors always seem to be showing up as the ones in. What do you do about it?
So in short, yes. So we have a system which looks at who were the individuals involved with that incident, where did the incident happen, time of day, a type of patient, diagnosis and the outcome for that patient. And so what we do, and the teams meet regularly to review that data to identify if there's particular clinicians who we are flagging a number of incidents or concerns, so we can then take remedial action with those individuals in terms of whether that be performance management, be that training or other support that person may need. So that's the process that we instituted, which helped kind of turn the hospital around. And so when we get the data, it's fine. So I think the issue here is less about our incident management system once an incident's been triggered, but more about the identification that something adverse has happened and then triggering that process and that system to work.
Yeah, when these things happen, there is a more stringent investigation into their qualifications made, just to see if they really are as well qualified as they tell you they are. Is that part and parcel of your checks?
Yes, so we routinely check not just on appointment but on an ongoing fashion as part of the revalidation process that both doctors and nurses have to go through, their CVs and their qualifications and their background and experience. So we do routinely do that now under our standard kind of employment system.
Okay, it's done, Tom, I'm just wondering about the example Kim gave was of somebody who presented a number of times, it would appear, at Basildon, was sent away for whatever reason, and then ended up at another hospital. Sorry.
Yeah. He was taken back to Basildon by an ambulance, but he was so poorly then that a team had to come down from another hospital to transfer him up to a London hospital.
So in a scenario where somebody has been turned away a number of times perhaps, and they then decide to take it upon themselves to go to another hospital, to present at another hospital, or maybe something that isn't part of the trust, is there a mechanism for actually being able to map that person has actually then gone on to receive treatment, unless they go through something like Health Watch? I'm just concerned that there might be people who this has happened, other people who this has happened to, who have thought, do you know what, I'll go to Queen's or I'll go to Tarrant Valley, and then if those systems aren't joined up, we may be losing that data.
So with children, the children's safeguarding system would notify us if there's patients who are repeatedly attending. Obviously, this case was a child, so that's one of the things we need to understand in terms of regularly to A&E would normally trigger our systems to look at what's going on in that particular case. So obviously I haven't seen the details of the investigation, it's still ongoing, so we've got to let that complete. But that works across hospitals, that system. With adults it's slightly different. So with adults we wouldn't necessarily know because we don't have access to information around adults choosing to be treated at different hospitals. So there's potential sources of that. So obviously there's the patient themselves or their family and carers who may report that. There's the patient's GP who will know through discharge letters and attendance letters that and GPs do let us know sometimes if there's concerns about something that's gone on within the hospital, and they would be the two primary sources. We wouldn't be able to run a report or anything from the hospital side on that because we just don't have access to information about adults who go to other hospitals at the moment.
Thank you.
Anybody else? Councillor Collins, you had a fair old crack of the whip, I think, so
yeah,
we'll leave it there for now.
So much to ask.
Oh, well, as ever, yeah. Anybody else got anything to offer? Oliver.
Thanks, Chair. Just to pick up where Councillor Apothecary left off there, is it too early yet to start to draw some lessons around those incidents in terms of where we think that went wrong? So in terms of the A&E in particular, is this a case of us too stringently trying to manage demand, or just not really understanding the details of the case that was presented in order to make a proper decision about treatment?
So I think it's something we need to let the investigations complete. So I think as part of our investigation process, a key component of that is around what lessons do we learn from that process, and so how can we prevent something like that from happening again. And so I'd suggest that perhaps when we come back, we give you obviously we can't give you the exact detail of every case, but we can give you some of the themes in terms of the learning that we've got out of those investigations, and more broadly out of other investigations that we're undertaking on a day-to-day basis.
Councillor Sheridan.
I was just wondering, Kim, have you got a rough idea how many cases have been reported to you recently? Is this sort of like an increase all of a sudden, what you're getting?
I think in the last 4 months we've had 22 cases. Some of them have been quite minor complaints about actual stuff going on the ward while patients are in there, but it is a big leap to what we're having. They usually trickle through maybe a couple a month, but this has been a sudden massive increase with some quite serious ones in there. In fairness, it could be that we have been doing a lot of work out in the community, and people that maybe didn't know about us before are now using us to weigh that out. But if there are that many, then it is quite concerning, whether it's a sudden increase or people just are aware of us.
Okay, thank you, everybody. Just have a look at the work programme, and the earliest we think we can get you back is November. Would you be happy to come back in November and give us a report and all that? Yeah. Excellent, thank you, Tom. Right, with nothing else...